Welcome back. We're going to learn more about kidney disease. The Pikangikum First Nation is a remote Ojibwe community in northwestern Ontario. In 2002, Louis Quill was the chief in Pikangikum. As I got to know Chief Quill, he was full of vitality. He had the ideas, the energy, and the support of the community to make positive changes. This was a family day he had organized where youth were encouraged to clean up their community. Shortly after I met Mr. Quill, he told me he was battling kidney disease. He even had a portable dialysis machine. Kidney disease did not stop him from organizing a march to Winnipeg. Community members wanted to call attention to the issue of youth suicide in Pikangikum. Louis Quill's health deteriorated over the years, and he was forced to move to Thunder Bay, Ontario for treatment. Louis's illness was frustrating on many levels. He couldn't continue his job as chief, his family was worried, and he was far away from friends and his home community. I didn't know much about kidney disease at the time.
My catheter here got infected.
Oh.
And at first we didn't even know. I just went for dialysis on a Monday, and then about half an hour before I finished the cycle, I started to get this headache, a real bad one.
Mm-hmm.
Louis's battle with kidney disease ended in 2005. He passed away in Thunder Bay waiting for a kidney transplant. He was only 38 years old. Louis Quill is not here anymore, but the legacy of his work can still be felt in Pikangikum. Thanks, Louis. It was an honor to know you and work with you. Today on Vitality, we're going to be speaking with a kidney doctor about what kidney disease is all about.
We have an epidemic of chronic kidney disease in Manitoba and Canada, and in fact internationally, predominantly related to complications of diabetes.
In our body, we have two kidneys, one on either side under the lower ribs, and they are needed to keep us healthy. They remove waste materials from our blood. When our kidneys don't work properly, poison builds up in our blood and we will get very sick.
The leading cause of what we call end-stage kidney disease, the point at which you require dialysis or a transplant, is diabetes. It's the leading cause amongst Aboriginal people, it's the leading cause amongst the general population. It's the leading cause not just in Manitoba, but in Canada and the rest of the world. Mild chronic kidney disease has been shown to be a risk factor for developing cardiovascular disease, so heart attacks and strokes. And basically, there are signs that people may have. Typically, those are more advanced signs. So for example, if they have blood in their urine, if the urine is grossly bloody, if the urine is very foamy, if they're swelling, if they're developing non-specific symptoms such as nausea, malaise, lethargy, that goes on for a protracted period of time, those are all symptoms of relatively late-stage kidney disease. So one doesn't want to wait till they have symptoms related to this before they're identified. All high-risk patients, and even those who may not be high risk but may be concerned about whether they're at risk, should have their blood pressures checked. And then they should have a urine test, a simple urine test. That's a matter of leaving a urine sample, and then it's analyzed by the lab looking for either red blood cells or protein.
To recap, signs of kidney disease are high blood pressure, puffiness of eyes, hands, and the feet, bloody, clouded, or tea-colored urine, frequent urination during the night, and being tired all the time.
They're identified early enough, and we could introduce some of these therapies to prevent their kidney function from declining. That dialysis is no longer inevitable.
And what are the therapies?
There's actually the medical therapies, medications. It would be drugs that decrease protein leakage, drugs that are used for other things like high blood pressure and for heart disease, but specifically used to decrease protein leakage. So that's one of the earliest things we would do. Most people with type 2 diabetes will also have high blood pressure, so we want to make sure their blood pressure is aggressively controlled. Smoking cessation. Smoking is not only a risk factor for cardiovascular disease, but it's a risk factor for chronic kidney disease, so it's imperative that those who smoke stop smoking.